Hello everybody, and thank you for joining me on this new video presentation. Before starting the presentation, I would like to invite you to visit my website for interesting EP cases and also the highlight of the latest top published articles in the field of cardiology, electrophysiology, and digital health. First, I would like to draw your attention to an important study recently published in Circulation Research. In a retrospective multi-center study, the authors included 1,128 adult patients with hypertension diagnosed with COVID-19, including 188 taking ACE inhibitors or ARBs and 940 without using these medications, who were admitted to 9 hospitals in Hubei province, China. In a propensity score-matched analysis followed by adjusting imbalance variables in a mixed effect Cox model, the results consistently demonstrated, interestingly, lower risk of COVID-19 mortality in patients who received ACE inhibitors or ARBs versus those who did not receive these medications. This is a 32-year-old man with sustained left atrial tachycardia who was admitted for EP study and RF ablation. So, here is the 12-lead ECG of the patient. At the first glance, we may see negative P waves in V1 to V6, which suggests an origin from the right atrium. But let's have a closer look at V1. Here we have a negative positive P wave actually, which suggests an origin from the left atrium. Here is a P-wave algorithm constructed on the basis of findings from 130 atrial tachycardias with an accuracy of 93%. Using this algorithm, we can localize the atrial tachycardia of our patient to somewhere close to superior mitral annulus. In electroanatomical mapping, we can see the earliest point and successful ablation site at superior septum close to mitral annulus. We already saw together this ECG last week. The question is, what might be the underlying heart disease which caused the ECG changes in this patient? These figures and the next video show severe hypertrophic cardiomyopathy and late gadolinium enhancement in septum in this patient. Artificial intelligence will play a major role in medicine. This study sought to develop an artificial intelligence approach for the detection of HCM based on 12-lead ECG. A convolutional neural network was trained and validated using digital 12-lead ECG from 2,448 patients with a verified HCM diagnosis and more than 51,000 non-HCM age and sex-matched controlled subjects. The ability of this network to detect HCM was then tested on a different dataset of 612 HCM and more than 12,000 control subjects. The model performance demonstrated an area under the curve of 0.96 with 87% sensitivity and 91% specificity. In conclusion, this model performance was consistent in younger population, those with left ventricular hypertrophy by ECG, and those with a normal ECG. A deep learning algorithm that incorporates ECG data can accurately identify patients with HCM across a range of subgroups, including those with normal ECG or LVH patterns, particularly in young patients. The ECG remains a cornerstone in the assessment of patients with HCM. Even more, it is undergoing a renaissance, not only because of its inexpensive nature and wide availability, but because it provides details that are related to morphology, function, and genetic substrate at the same time. In this interesting and detailed review, the authors discuss the current role of the ECG in the diagnosis, risk stratification, and management of patients with hypertrophic cardiomyopathy. Despite recent exponential development of imaging techniques, a learned interpretation of the ECG provides invaluable clues in the early identification of the disease, the differential diagnosis with the other causes of left ventricular hypertrophy, or with physiological adaptation in highly trained athletes, and detection of features that may suggest a high risk of adverse outcomes. So, that was this week's presentation, and I would like to thank you again for joining me and hope to have you here in my future video presentations.